Now we're ready to rock. Good morning.
Yes, morning. Yeah. Good evening, everyone. 7 o'clock here in the States for those catching on replay in the morning. Um, because the UK is sleeping. Welcome. Good morning. It's a good morning to them. Welcome to all you guys here with me, Tanya, Karina, Beverly, Shay. Uh, awesome, Shay. Hey there. So I have a bunch of questions that are on different graphics, some in the app. I have some that are in the Facebook group, but this is open for all that are here to be with that are with me. If you want to ask a question here, and thank you for the questions that were asked on the graphic. So I have something to talk about, and I will honor those questions by answering them, read them aloud and answer them so that everyone can hear who's listening on replay. Um, so I'm going to go to oh, there's Celeste. Let Celeste in. Welcome, Celeste. Awesome. I will do the questions first in the app community, and then I'm going to flip over to Facebook. And so Jessica just put that she was looking forward to our replay. Well, welcome, Jessica, in the morning when you wake up. So Carrie Hill has a question, and I'm gonna hit that one. I know there's a few that go together. Let me just see if I can. Oh, I like your question, Carrie, about testosterone and DHEA. So I'm gonna do that one, and I'll try to refer back for those questions that might be similar. So there's Deborah. Welcome, Deborah. There she is, Deborah. Welcome. Thanks for your support. Thanks for jumping on. So I'm going to read Carrie's question first. I'm going to a new doctor on Friday. I'm still suffering from a lot of fatigue. My last doctor said no to the increase in progesterone from 100 milligrams to higher, citing a study showing it could increase chance of cancer, but I have not been able to find research, nor have I, to support this. My question is, I want to start taking testosterone. My question is, what's the difference between DHEA and testosterone? I feel pretty good most days, but the fatigue is real. I just feel like maybe I have low testosterone. My TSH levels are normal on my last blood tests. And if the doctor says no to testosterone because it's off label, would I benefit from DHEA? So, okay, little bit about DHEA and testosterone, which is cool, a little bit different. I've admitted before that I don't prescribe testosterone because of the difficulty with changing the male approved hormone preparations for women. So I just never really got into it. It just never became part of my practice. But I do have colleagues who do prescribe progesterone. One of the products that we have access to close by is a compounded product. And that is a way in which you can do a way in which you can do testosterone for women, because you can make it much less of a dose to make it much more appropriate. I just, again, I haven't gotten a lot of experience around prescribing it that way. So I myself don't prescribe it, but I usually try to find people, prescribers who do, who are interested. I also have colleagues who use the testosterone pellets, who, I'm sorry, administer the testosterone pellets. And again, that would be somebody that I would refer a patient to. So it's a great question. So testosterone, for those who don't know, is made in our bodies as well. It's converted from estrogen into testosterone in some different enzyme processes in our body. So actually our ovary is responsible for our testosterone levels as well. And the adrenal androgens are precursors to the androgens, can be made into testosterone as well. So that's two sources of testosterone for all people, men and women, in their body. So certainly, of course, male testes make significantly more testosterone than female ovaries do, but it gives us what we need. And so what you find is similar to estrogen levels in menopause care. Um, so the drop in testosterone can be responsible for some of the symptoms that women feel in menopause. It's been associated with kind of like low mood, depression, or of course, low libido is very a common complaint. People just cite just like a blah feeling, but to be honest, it's very similar to low estrogen, and sometimes it takes just blood work to see that the testosterone is low, and that by supplementing both, patients do well. Testosterone is good for your bone health as well. So having testosterone in the mix with your hormone replacement therapy is great for your bone health as well. So there are advantages to taking it. The theoretical disadvantage to taking testosterone is that they thought that it would result in increase in cholesterol levels, and it doesn't seem to pan out. So even for men, it doesn't appear as, because they used to try to hypothesize why men had cardiovascular disease at a higher rate younger than women did. So the hypothesis was somehow thought to be linked to testosterone. But what in fact it turns out to be is that estrogen is protective. It's not that testosterone is bad, but that estrogen is protective in a woman's body against heart disease, because it keeps that balance of cholesterol favoring good cholesterol over the bad cholesterol. And then with the drop in estrogen, our cholesterol levels will be similar, in fact, to what men are seeing 10 years sooner in life. So it was actually that the estrogen was protective rather than testosterone being associated with elevated cholesterol levels. So there isn't a lot of downside to taking testosterone. So if somebody that you go to, is Carrie Ann, that's my boss's name, Carrie, just intermittently mixing you guys together, is some that you're going to is comfortable prescribing it, that's great. It's just that I'm not myself personally versed in the different dosing and things like that. So that's testosterone, and it's certainly a way to supplement. So DHEA is another way to supplement androgen in women's systems. So it is one of the precursors in the adrenal glands for androgen, so or testosterone. So it can boost androgen, and so give you that same benefit that testosterone does. There's very little downside to taking DHEA. It's very similar, in fact, to testosterone. The downsides is that too much androgen for a woman can result in acne and hair loss, believe it or not. And so more of those like unwanted side effects. So DHEA, similarly, too much of it could cause more of an androgen more of the swing between estrogen and androgen balance to go towards the androgen, leading to hair loss or acne or the unwanted side effects of having too much androgen. So that's just one thing to watch for. But you can take DHEA as an over-the-counter supplement, and it's available in different forms, and you can kind of use use it on your own and see how much of it works well for you. So it usually comes as a 25 milligram, 50 milligram, or 100. I haven't seen 100s. I take that back. Or 25 or 50 milligram tablets. You can start with 25 and go out from there, but it's essentially available to you in the regular pharmacy, on Amazon, all the things, as a supplement. It's also been used I think it converts weekly to estrogen, weekly as in WEAKLEY, not WEEKEY, to estrogen. So there's a vaginal preparation of DHEA that's been used for vaginal dryness, and it works well for those trying to avoid too high of an estrogen level. DHEA works well. It's converted to a weaker estrogen and used vaginally. So that is an option. It's hard to say, are they the same? I would say honestly, the effect is similar. And some people are going to sing the praises of DHEA, and some people are going to not feel a difference. I would say personally, I did try testosterone cream. And I would admit that the problem is that you have to use it. And I'm sometimes not a very compliant patient. It's easier for me to remember to take a tablet than it is for me to remember to use a cream every day, only because I feel like there's a lot of creams in my bathroom that are part of my routine, and it makes it very hard to remember all the things. And so honestly, I was forgetting. So I won't dog the treatment because I don't know if it would be helpful, because I believe you have to be consistent for it to be helpful. And I would admit I was not very consistent. And I did admit it to my doctor. So instead, it was easier to fit the DHEA into my routine. So I put DHEA in my routine, and I personally take 50. I was taking too much. And I did think that that was related to that some of the hair loss that I was getting, but thankfully I am starting to see that improve. So I think that dropping down a little in my DHEA was helpful, of course, because I'm a more is better kind of gal. So if someone says 50, I go for 100, and it was too much. But I definitely did forget to put it in my pill box one week, and or maybe a week or so, and I did feel that it made a difference to put it back in. Um, so Mixed G, driving, so listening, you got it. So as a brand for DHEA, so vitamin brands that I usually look for on Amazon is the Now brand. It's an organic brand with a bright orange label. So that's one that I use regularly. The other one, sugar. Let me look on Amazon quickly. NutriCast. NutriCast is one that I use frequently. Um, and Designs for Health is another one. Designs for Health is generally a bit more expensive. NutriCast and Now can be a little bit more affordable. And Now is one that comes very highly recommended by others in kind of more of the natural supplement community. So those are the ones that I go with. So DHEA is different. So I'm sorry for those who are listening on replay. The question is DHEA the same as evening primrose oil capsules? No, they're completely different. DHEA is a very long word that ends in androstenedione, and the evening primrose oil is more along the lines of the omega-3 fatty acid type of a supplement. So evening primrose oil comes in a little capsule, and it's literally an oil on the inside. DHEA is more of a hard tablet. Usually they're capsules, and they're filled with more of a powdery thing. So I'm just gonna go up here because Mixed G asked regarding, is CMOS something we should take? To be honest, I don't know. I've heard of CMOS, but I don't know the benefits of it. So I couldn't necessarily recommend it, but let me look first at a um, real quick to see what it is and what it's supposed to do. Oh, it's I think associated with like it's like more of a vegan friendly omega-3. Um, that is my only guess about now, but I would look. I would say, I usually say for supplements, which is really awesome, is that there's usually very little downside to most of them. So I think that you can very easily add them to your regimen if it sounds like if it's right for you. The only thing I would say is the worst case scenario is that you're wasting your money, and only you can be the judge if it works for you, and if you find that you try something for a while and then it's just wasting your money. I usually try things that appeal to me for usually like 2 or 3 months to see if it makes a difference, and then decide whether or not it's something that makes a difference enough for me to continue to invest in it. Because I have to admit that my supplement box can get very crowded, and it would be embarrassing to admit how much I actually spend. I don't think you can hear me. how much I actually spend on supplements, because optimizing my health and my performance is very important to me. So I try a lot of different things. So I'll keep you posted as the personal guinea pig. So Celeste asked, do you think it's overkill to use estrogen patch with oral progesterone for systemic benefits and vaginal cream for genital symptoms of menopause and estradiol cream on the face for rosacea? No. Celeste, you sound like my kind of gal. No, so they all have, I'll go through them for those listening on replay who might be curious and why I would say that that is not an uncommon regimen. It's not an uncommon regimen for a patient of my own because they get at different things. So certainly the estrogen patch is your hormone replacement therapy. The oral progesterone is needed to protect your uterus, which is what we've been saying for years. But I would say also some women who don't have a uterus might choose to take progesterone with their estrogen replacement therapy because it can be kind of the balance. We want to keep that estrogen balanced. And whereas estrogen is great, she can make you be a little bit more edgy. Progesterone can kind of calm that down a little bit. So I think that it's great. And I would say for some who don't have a uterus, it's still sometimes appropriate to take progesterone. It's a really good hormone replacement to take before bed at night because it can help improve your sleep. And to be honest with you, Celeste, I'm with you. It's not unusual for my patients to find, or for me to have found through the experience of working with my patients, that the systemic estrogens don't always help with vaginal symptoms. So putting the estrogen exactly where it works, I think has a tremendous benefit. So I would just say I bless you for all the work that you're willing to put in, because that just to me seems like a lot of work. And I personally wasn't able to maintain my regimen for the vaginal estrogen either. So I was bad about that one too. So, and that one I did not have to admit to my doctor because the product that she had recommended for me, I didn't buy because it was $500. So the vaginal ring is amazing for those who are interested in the treatment of vaginal dryness or atrophic vaginitis or genital symptoms of menopause, however we want to call it these days. The vaginal ring is fantastic. It just is unfortunately can be very, very expensive if it's not covered by your insurance. And then to be honest, Celeste, the estradiol cream for your face, go for it. I mean, if you're finding that you're okay with the regimen, I don't believe, I was looking this up because there was another related question. I don't believe there's a lot of absorption from this skin, or similarly, there isn't a lot of absorption from your vaginal mucosa into your bloodstream. So you're not like overdosing yourself with estrogen by using it in all these different places. In fact, the what you're putting on topically is not very readily absorbed through your face or through your vagina, at least at the amounts you're using them. So if you honestly wanted to supplement estrogen vaginally, you would have to use significantly more than what's recommended for just treating the atrophic vaginitis or menopausal symptoms of the vagina. So I would, if you're up for the task, Celeste, go for it. You're doing great. Okay, and so to follow on that, there is another question here from Shay. What are your thoughts on estradiol patches and micronized progesterone as opposed to topicals or pellets? So estradiol patch is like my favorite prescription. It's something that I believe is very reliable as far as the dose. I know that we can patients are getting a reliable amount. They have consistent relief of their symptoms. So I really like the estradiol patches. Micronized progesterone is also my progesterone supplement of choice. It's the closest to, it's obviously it's identical to what the progesterone our bodies make. So that's been a terrific product since it's been available to us. It's something that we used in fertility practice as well. So when, there was, when we were supplementing progesterone and there was any possibility of pregnancy, it's 100% safe. So it's anything that is safe to give a woman who might be pregnant, to me, is really great in my book, because that means it's passed all the seals of approval if it's safe to use in that context. So I really like that combination very much. So I know that estradiol has been available in pellets, not something that I've ever done. I have no theoretical reason why I wouldn't, because as far as my preferred method is, I like transdermal estrogen. So transdermal estrogen, meaning that you don't have to take it as a tablet, it doesn't have to be digested in your system, doesn't have to be processed through your liver in order for it to be active and useful to your body. So bypassing the liver in my book is fantastic for a couple of reasons. One is, your liver is working hard enough. The other is that because the liver has to digest the tablet, it seems to activate pathways that can increase clotting factors. And so that is why that's what makes estrogens related to an increased risk of blood clots. And that risk is negated by having a transdermal preparation. So as long as somebody can tolerate it, my preferred mode of delivery is topical. Believe it or not, I've had people who have reactions to the adhesive on the patch, similarly reactions to the actual creams. And so if you're just a very sensitive person, sometimes it comes down to needing to take it orally. That's forgiven. I forgive you. And I definitely will make that prescription if it's necessary, but I kind of exhaust all of the topical or transdermal preparations that I can before that. So is there a baseline where you start patients and then go from there? For sure. So usually when we're just starting out hormone replacement therapy, I start at a lower dose and build it up, just because it's not necessarily that more is more, because the benefits are, as long as you have no symptoms, the benefit of the estrogen is the same. So taking 100 micrograms of estrogen isn't more beneficial than 50. As long as you're not having any symptoms. So, because the threshold for bone health, if we were just looking at it that way, by way of example, the threshold for your bone health is only 15 to 25 micrograms of estrogen. So but to keep you from being symptomatic, usually we're higher than 25. I'd say it's very rare to have somebody that low when we're talking about symptomatic care. So Shay adds that she started the 0375 patch, perfect, and progesterone at 100. Sounds great. The 100 milligrams of progesterone tablet, taking 2 capsules daily. Carrie, you missed it. We were talking about the rift about the 100 to 200 milligrams of and somehow having some association with increased risk of cancer with the 200 milligrams of progesterone. But you see, Shay was also prescribed the 200 milligrams of progesterone. So I was just answering your question before, unfortunately, Carrie, before you popped on. But I was saying is I have not seen anything that supports that either. So go ahead and listen back to, because we talked about the testosterone and DHEA. It may come up a bit again. But if you have any questions, just go ahead and throw a little add on to your question on in the app on that question graphic that we had. So Genevieve asked a really important question. Why don't I feel better if I'm taking HRT? It's a really good question, Genevieve. The question is, how long have you been taking it? What dose have you been started at? And what do you mean by not feeling better? So the question is that if you had some symptoms that you were taking, and then, symptoms that you started it for that are not improved, maybe you're not on enough. If you didn't really have symptoms, but you started it, and then you were just waiting to feel better, it might take more time. And then the other thing to always consider is that maybe something else is going on that needs some attention. So it might just draw to light that there's other things that need to be addressed. Let me see if you're okay, perfect. So I would look at those things, Genevieve, for sure, and pop anything in the chat box that you'd like to add. So Carrie asked, can you recommend anything over the counter for vaginal dryness and painful intercourse? It's probably scar tissue that's been there from children 10 years ago. Yeah, so there are a few over the counter things that you can buy. There is, well, over the counter. One of I know is on the internet. So a product called Reverie is on the internet. It's made by a company called Bonafide. It's spelled let me put it in for you, Reveree. And you can find that, on the internet. Again, the company is called Bonafide. They don't sell in stores. They're a supplement, like a natural company, but they're available online. I've had quite a few patients use their suppositories with good effect. Another product you can buy in the market, so real easy, right in any CVS, is called Replens. And there's one that's also Luvina. But to be honest, if you go into the market and it says, the product says on it that it's a vaginal moisturizer, it's typically the same type of product. But what gets confusing is that when you go into the feminine hygiene aisle in the pharmacy, is that you want to look, because there'll be that whole section that nobody wants to linger too long at because they're embarrassed. But you look at that whole section and you want to look for the keywords on the product. So because many lubricants are in the market. So Carrie, when you go to that aisle and you want to buy something over the counter, there's lubricants and there's moisturizers. So typically a lubricant is used just during intercourse. No problem at all. It's grand. It's a great choice. But it doesn't work as a vaginal moisturizer. So you can use it during intercourse, and that's really all it's good for. However, the vaginal moisturizer products are something that you can use a few times a week. Just place it vaginally as part of your nighttime routine, and it helps with moisture overall. I would say, honestly, in addition, you would probably use a vaginal moisturizer at the time that you have a lubricant at the time that you have intercourse, but the moisturizers are much more like akin to like using lotion on your skin, whereas they just help to improve the moisture overall. And it usually lasts a little bit of time. So again, you can use those products a couple times a week. So similarly, the Reverie product that you can buy over the internet as a suppository, you can use those suppositories a couple times a week. But then you would also have a lubricant during intercourse. That usually works pretty well. So the other thing is that honestly, what makes a great lubricant, a lubricant can be coconut oil, which is a nice natural product. And honestly, I've had patients who use coconut oil as a moisturizer. So just honestly, extra virgin coconut oil that you would get for cooking. You can just take a dollop, because it's a solid, and place it vaginally, and it works quite well. From what I've been told. And it works well as a lubricant during intercourse. I would just caution that for your clothing and for your sheeting, because it is an oil, it can stain. So you just want to be careful, maybe wear a pad when you use it. And if you don't have your best sheets on, or ones that the coloring doesn't matter, if you have if the oil makes a mark on it. So, okay. So, do you take Molina insurance? I need someone to prescribe a compound pharmacy, so I don't take the chemical version. Are you taking new patients? So actually, I'm in Connecticut. So I don't know Molina insurance. But because that's the kind of thing that I don't look for. But yeah, I mean, you're welcome to call the office. It's real easy to find the number on the internet if you just put me in Google if you live in Connecticut. To see if I'm close enough by. I'm in my private office, well, private office. The where I see patients outside of the hospital is in Rocky Hill, Connecticut, if you're familiar with the area. And I will be seeing patients in Waterbury, if that's closer, just to put some reference around where I'm at.
But yes, we always take notes. And if they give you a hard time when you call, because I am
Most of my patients are by referral. Just say that I told you to call, and they won't give you a hard time. My Sharon, who answers the phone, is really great. But
they are like the gatekeepers. So it's like,
they always look for a referral. Because of my subspecialty, they're always looking for a referral. But yeah, just tell them I told you to call. Okay.
okay. So I'm going to hit Lisa's question and then I'm going to go back to the graphic.
Oh, wait, I missed Carrie. Carrie answered. Yes.
So Carrie just said, hopefully on Friday, the doctor will say, okay, the increase in progesterone.
Yeah, I honestly couldn't find anything, and progesterone is something that I prescribe very comfortably. I personally take 300 milligrams daily, and I've prescribed as much as 4.
My OBGYN was a little like, when I wanted
400, she was a little like, ooh. I was like, all right, I'll try 3. I'll play your game. So no worries. So Lisa asked, I'm not sure if you've answered this in previous call, but I'm really confused about taking HRT or not. I am 53 in menopause, and I have my initial symptoms under control using a natural supplement called Hormone Harmony. I've had
great success with EMBM programs. So
I have my diet, weight training, and weight gain and training sorted out. I had my bone density scan done, so I have a baseline, and I'm normal with nothing to be concerned about. So I'm really not sure if I need to go down the HRT line or not. So it's a really good question. I would say, on the complete, like I would say that we in our profession, generally speaking, have not started hormone replacement therapy for women that are asymptomatic or they haven't had, and they have no complaints, unless bone loss. And that's someplace where if you do get a scan that shows some bone loss and you're younger, it's something that I might bring up as one of the treatment options, because there's so much clear evidence for that. But I would say that where that means that some of the mainstream has not yet caught on to all the things that I know intuitively about the benefits of estrogen. So you could definitely consider for yourself that, there is a benefit for cognitive health. So if you're concerned about, like maybe this in your family, any history of cognitive decline, you may be a very good candidate. So your, metabolic health, things that decline with time. So it's hard to say because they haven't stacked up the evidence for us for all of these things to the point at which they handed it over and said, you guys should be doing this for your patients. Otherwise, it's near malpractice not to have them have that advantage. But when it comes to thinking about that for myself, I think about that for myself, because I'm not risk averse. And I always say to patients, what's really important is that I'm risk averse when it comes to being a doctor. I'm not risk averse with my own health. Is that you have to weigh out the risk and benefits, even if you are symptomatic, and decide what's best for you. Because obviously, we're not talking about something, although now you might be talking about something that could quote unquote kill you, in the sense of that, in 10 or 15 years from now, we don't want to see the long out there sequela of having lost our estrogen. But some would say that's part of our natural aging process. And I'm willing to buck the system as hard as I can to like hang on to the things and not necessarily have to do the natural aging process. But not everybody feels the same way about it. If you're all in on optimizing your health in every other way, there's a good chance that that you won't see those downsides from the estrogen, and that you wouldn't have needed. But if you're have very low risk, then you'd say, well, and you want to know that you've had done everything, done all the things that you can, because unfortunately, I don't think we're going to know from years till years from now, whether the estrogen would have made a significant difference to our lives. Like, so like, is it worth maybe being on a small dose of estrogen just to maintain those things? Well, I think we're starting to head back in that direction. When years ago, when the nurses study had come out, long and long and long ago, before the WHI study, these were studies that showed that all of the benefits early on, very early on, of taking hormone replacement therapy for women, and that was part of the hypothesis building that came to the WHI study, and the one that ruined it all for everybody. What I mean is that they were doing these studies and they were showing so much health benefits for the women that were taking it, that it was nearly like as soon as women went into menopause many years ago, they received hormone replacement therapy, not as a conversation, but as a knee-jerk reaction. So you went into menopause, you took estrogen. And that was the way that it continued for many years until they did the big WHI study, and then everyone dropped their hormones like a bad habit. So then now the pendulum swung so far back, but I think we're starting to come back, where at least we're saying now, okay, it's safe. It's safe to prescribe it in these situations for these people and for these symptoms. But now we're starting to notice that there are all these other benefits that women are experiencing from being on it, because now we have more years of women being on it again. And so the data is amassing in that direction. So would that in a few years from now, we're going to be back to where we should just start it when we go into menopause? I wouldn't be surprised. So, like, you certainly could be of the mind, and even women who years ago went into menopause, they might have been on the mind that, I don't want to take that stuff. So they didn't. But there was a lot of women who just did because their doctors gave it to them. So there is benefit. Does it have to be very much? Probably not. As we were saying, it could probably be very, very low dose and still see the benefits of in where it comes to cognitive health, bone health, and all the things that we won't see for years into the future. So it's hard for me to necessarily make the recommendation, but those are at least the benefits that are out there. And the question for you is, do you feel like you're a good candidate and you would feel deprived of those benefits 10 or 15 years from now if you knew that you could have had that opportunity? And I think it's a really hard question when you're like, I'm doing so good. Like, what do I do if I'm doing so good? Like, is that worth it? You're probably getting some of the benefits of there's probably phytoestrogen in the product that you're getting. And so you're giving yourself some estrogen, whether it's going to be enough to make a difference when it comes to, you know, uh, cognitive health and other benefits that women are seeing. I don't really know the answer to that. Um, yeah. I'm sorry, that wasn't very helpful. It's kind of like I think that, like I said, for myself personally, it's easier for me to say for myself personally, yes, I would take it even without being very symptomatic. Um, Personally, I was not that symptomatic when I started, or at least I didn't think I was. Except that I found that, like, although as time went on, I needed more. So I must have been more symptomatic than I thought. So yeah, so I do believe that if there's benefits out there, I'm willing to, I'm all in. I'm willing to do it. So it's definitely a personal decision. But yeah, that's clear as mud. You got it. Yeah. Yeah, no, it's definitely, so Lisa's just saying she agrees. It's a hard call. And I can understand your confusion around it. And I think that it's just something that you have to search your soul on and decide what's the best way to go for you. And I just feel like it's worth, for me personally, just to know I've done everything that I can. And I was thinking it because I was starting to get more symptomatic, so it was easier to justify in my mind. Yeah, Carrie, I'm sorry. I did answer regarding DHEA and testosterone, but I think another question comes up. So if you don't get a chance to listen to the front end again, just the first short while, because yours was the first question, then I think it comes up on one other question.
But Cal was just saying that
Her doctors refused to prescribe HRT because she was too young to be postmenopausal, 42 at the time. Went through my Winona online to get my prescription HRT cream, bypassed insurance because it's about the same price with a lot less hassle. Fair enough. HRT has been a lifesaver and 100% worth the out-of-pocket cost. I get where you're coming from for sure. It's definitely, when you feel what's right for you and you have to get access, go for it.
okay. All right, I'm going to just go back to the graphic and then I'm going to
Get to the ones that I'm getting on here as well.
So, oh, Pam just Carrie,
Pam just answered to you as well that she on the graphic that she was taking she increased the 100 to 200. Everyone doesn't want to rub it into you, my friend, right? Anywho,
so yeah, oh, Carrie, we were just talking briefly about with
the last question regarding estrogen on your face. I guess because it's just working directly into the estrogen receptors on your skin, I suppose it has more benefit than. So sometimes people taking systemic estrogen will certainly see the benefit of estrogen for their skin. Sorry, just for those listening on the replay, Carrie's question was regarding topical estrogen on your in your cream on your face. It seems to be beneficial. I have no. It's more of a cosmetic recommendation than a medical recommendation. I haven't seen any patients say that they had great results with it. I keep hearing about it myself. It's as more of a curiosity. It seems to make sense because as we were saying, like with vaginal estrogen and vaginal dryness, sometimes taking systemic hormone replacement therapy doesn't necessarily help with the vagina. And so similarly, it might not always help with the skin, but putting it directly on your skin might be more helpful. And we were saying that it's not additive to the amount that you're taking because what's put on your face isn't going to be absorbed very much into your system. So there was a question regarding the absorption on the other graphic, and I'm going to get to that as well. But yeah, so the benefits Coach Dre was saying for you, Carrie, is that it's supposed to increase hydration, elasticity, boosting collagen, and melanin levels. So all good stuff. So to be honest, as long as it's not, I always say if it's not too expensive, it might be worth it. We got to use creams anyway. So if we can put the estrogen in there and it's not too expensive, there's certainly no downside to it. Oh, so yeah, Pam's question was interesting comment. Wonder if there are risk factors that might be associated with using estrogen on your face. No, assuredly, Pam, I don't believe that using it on your face is going to be absorbed enough for it to increase risk at all, unless you find that, I don't know, I've just gotten too beautiful. That could always be a risk. Always got to be careful of that one for sure. Cool. So I'm going to go to the graphic in Facebook now. Perfect. Okay. So, oh, okay, that's a good question. We'll go to that one. Okay. So, Donna Ahern asks, in the last session, I mentioned natural alternatives to hormone replacement. Can you go into that more, which kind of leads into what we were just talking about with Lisa? Lisa's taking hormone harmony. My doctor doesn't even want me to eat tofu. So I'm wondering, would natural alternatives carry an increased risk as taking actual prescription hormone replacement therapy? Her twin sister had a very aggressive estrogen positive breast cancer. So natural alternatives to hormone replacement therapy typically have been uh, herbal supplements that are black cohosh, maca root. I think of some others off the top of my head. Different ones that have kind of they're in the end, sorry, in essence, the names aren't coming to me. Those are the two ones, maca root and black cohosh. They are phytoestrogen in a sense of they are similar, like tofu is also these are weak estrogen receptor activators. So, but they work on a different estrogen than does estradiol. I'm sorry, a different receptor. So we have alpha and beta receptors for estrogen in our body. They work a little bit differently in the tissues that are responsive to estrogen. So these phytoestrogens work on these B receptors. So they have a weaker action overall. But for some people who use these natural supplements, they work well for them. So maca root and black cohosh have been used for many years by women for menopausal symptoms, and they work quite well. What's the other one I'm thinking of? Rhodiola is another one, but rhodiola is more of an anti-inflammatory, which is why it is helpful. But I'm trying to think of a company that makes it. There's another one that they'll put these blends together, but the nuts and bolts of it are that they work on these other receptors or these alternative receptors for estrogen, and they can be helpful for I would always say for mild symptoms. So I think that they are helpful. You have to be very committed to taking them, Donna, because they can take several weeks to make a difference. But if you're committed and you're in, then you can try a supplement like that. To be honest, so genistein is the phytoestrogen that's in tofu, and it actually is also available as a supplement. And it works well for hot flashes. It also works quite well for bone density. So that is a benefit as well. I will respectfully disagree with your doc regarding tofu, but I think that these are things that you can take as well. If you were looking to stay away from the phytoestrogen properties because of the way they act like tofu, I say that things like maca root, which is not phytoestrogen based, and rhodiola, which is also not a phytoestrogen based, and what's the other one I was thinking of? Oh, tart cherry is also anti-inflammatory, not phytoestrogen based, and they can be helpful for alleviating menopausal symptoms without hormone. So I love this. Marcy Fenton, I am so willing to be your mom. So her question is, hi, Dr. Rachel, in regards to yet I don't have her to ask. So I'm so willing to be here for your mom question. That is my role in life, and I would love my hypothesis. So Marcy, I would say the answer is quite disappointing because I will have to say my worst sentence is it depends. So not everybody does it the same way. There is a broad range of ways in which women's periods will stop. Some women will get lighter and lighter and lighter with time. And they'll have a monthly cycle, but it'll just keep getting lighter and lighter because they're not making as much estrogen. Estrogen stimulates the lining of the uterus. Stimulating the lining of the uterus, then, once the progesterone is taken away, there's withdrawal from the estrogen, from the hormones, and then your period comes. And so if you don't have a very thick lining, you don't have very much to bleed, and you have a very light period. Some women will go months without their period. They'll be,
because what's happening here is the estrogen is all over the place and
the signal doesn't go to the ovary, and what you don't actually ovulate. And so what happens is you don't ovulate for several months. You go 3, 4, 5 months without your period, and the next thing you know, you have the period from hell. That is a very common occurrence where women will skip several months and then have a very heavy period that oftentimes will last longer than their typical period normally would. So it runs the gamut from one to the next. I will say that it is very common to have abnormal bleeding or heavy bleeding in perimenopause. It's a time in a woman's life where I see very many come in with heavy cycles. But luckily, there are tons of things that will treat that. So certainly see your provider if that's starting to happen to you, but it really depends on the person, how they go down. I've also had patients say they just got their last period and that was it. Pheno, the end, no drama, no heavier, no lighter, last period, donezo. So it really does run the gamut. I always say for those who go out like that, just don't advertise because your friends will be very, very, very upset with you. But yeah, no, it doesn't really happen the same. So, but Marcy, anytime you have a mom question, I'm here for you. No problem. So Sarah says, I'm 40 years old and started using a 0.5% estrogen gel 4 months ago. She has an IUD, Mirena, in place and using the gel daily. And since starting it, she's found that she went from no periods to bleeding frequently with using the estrogen gel. And then she does have endometriosis, wondering if there's a correlate to the endometriosis to cause the increase in bleeding, apprehensive about using it, unsure if this is the reason for the bleeding, stopped taking it a few days ago after experiencing more bleeding, and since stopping thus far, no more bleeding. And is this correlated or am I reading into it? No, Sarah Margaret, you are 100% correct. It's very likely that this is because of the estrogen. You may just, you certainly should call your provider because that just needs to be adjusted. If you were taking the estrogel because you had symptoms and you needed to balance that out, then you certainly need to check in with them and find a way to balance it out so that you're not bleeding. Because certainly the not bleeding, starting the estrogen and bleeding is certainly related to the estrogen. And I would definitely just might need some balance between the two. So you just want to let your provider know what's going on. So this is actually very similar to Celeste's question. So Mimi, I'm just going to give you you probably, if you're listening back, you heard the answer to Celeste, but similarly, Mimi is saying that she was prescribed the E-string, which is the product I was talking about that I love very much for vaginal dryness, a combo patch, which is a great patch that combines estrogen and progesterone in the same patch. So one medication, one and done for menopausal symptoms. And then she heard that using estriol on your face can help with sagging skin. So would adding over-the-counter version of estriol in a cream once a day, that's 175 milligrams of estriol, 84 pumps per bottle, be of concern? So from looking at the estriol preparations, Mimi, I was just looking them up to answer your question. My guess is that is the whole bottle of the estriol, because most of the ones I saw were in the microgram levels of estriol. So you just want to look. I'm not 100% certain, but again, as we were saying with the other questions, I don't believe that using the estriol cream is going to add very much to what you're doing. So you can go ahead and freely use the estriol cream. It's not going to be absorbed very well through your skin from the estriol cream. So go for it. Good, good, good. All right. We got through all of the graphic questions. I'm going to go back here, make sure we get these before we leave. And I just want to read all of the comments out for you guys. We were just reading Kel's question regarding getting the HRT out of pocket. Worth it, worth it. You got it.
Lisa, we got that. Yeah,
Carrie Hill saying HRT has been a game changer as well. Awesome, awesome. It really can make a difference for some. I know, Lisa, it's hard to hear all the things that people say, and they're like, "Am I missing out on something wonderful?" And it's, again, if you're doing well, it's just a personal decision. But it's like, I want some of that. I want to know that it's a. But again, if you're feeling well, you might not feel much of a difference starting it because because if you're feeling well, and it's hard to measure better versus better, you know. So but it would only be like whether it has those long-term advantages for you.
so Mix G says, since I lost my
Compounding doctor, I've only been taking dim
in the AM and the other one
one at night. Let me just look at what it is.
just making up a random treatment. Let's see, what is this? I can usually see it if I hit this. Okay, so this is Chromomax, iodine. I must look silly looking at my screen this close.
Resveratrol, okay, and saffron. Not bad. I mean, if this is helpful for symptoms. So just some symptoms, just some herbs that are known to be good for, mood and things like that. Resveratrol is good for your circulation and inflammation. And then what is this one? This one is, oh, this is the dim. This is cool. Dim is good. And
Oh, those are the fronts of the bottles.
yeah, I mean, honestly, if you're doing well with those, mixed G, then that is great.
Whatever works for you is good. And then,
Yes, Carrie Hill, ashwagandha is helpful. So ashwagandha is an adaptogen that's it's good. It's like it's shown to be helpful for sleep and also for libido, so it's definitely worthwhile. And then you got it.
oh, Cal, no problem. We missed her. She said she had to get going. We lost her a few minutes ago. So if you listen back.
You got it, 100%. Lisa has this here. Let me look at the hormone harmony. Why can't I make this bigger? Let me see.
Oh, there we go. Okay. So, Pydium, KSM 660. Oh, that looks like also it's a
Root extract, Vitex.
rhodiola is in there. Forsculum. These are a lot of things I can't say. Heck, but if it works for you, that's great. That's great. I gotta make this small without, there we go. Okay, good. That was didn't want to close the whole screen. Perfect. Absolutely. Yeah. So
I wonder if there's a way for those listening on the replay. So for those listening on the replay, because someone had asked about natural supplements on the, it's what Lisa is taking is made by the company Happy Mammoth. So cute. Look at the little picture. And the supplement is called
Hormone Harmony. And again, the company is called Happy Mammoth, and it's Hormone Harmony. You won't be able to see that on the replay so if you could find that, there you go. Yeah, the ashwagandha is really great for stress. So, yep, I want all the long-term advantages. No problem, Mix G. You'll get the compounding back. You got it. Well, guys, you guys finding a way to help me
Fill another hour with chatter. Good job.
We never seem
To run out, do we? That's pretty cool. That is very cool. Well, thanks, Lisa, for sharing your supplements and for those sharing. You got it. Thanks for those sharing what works well for them.
100%. And yeah,
Carrie, we didn't wind up going back to, and I guess that yours was the only question about DHEA. So we were just did a little bit of the DHEA versus testosterone at the beginning of the call. But yes, you can use over-the-counter DHEA to help with some of the symptoms. And we're saying you can take a 25 to 50 milligram tablet And those, so you can kind of just balance out what works for you. The only downside to the DHEA is for people who've taken too much is acne, and you just want to watch for any effect on hair because it does affect the estrogen androgen balance, and that balance can affect your hair follicles. And that would be the only thing to watch for. So it has been used, and I know it's Dr. Peter Attila, is that the right one? Attia's hack for getting around testosterone. So it's been used by many of us to get around that. Cool. Well, ladies, it has been really my pleasure to hang out with you. I'm gonna go eat some dinner.
You got it. Drive. I like keeping you company while you're driving. Perfect, perfect. You got it.
All the best to you guys. Thanks for joining me, Tanya, and listening as always. I can rely on you. And I will see you guys really soon. Be good.